Ki khubor ka Batesi TV. Rake ka Frank Yamaha Katan Rio Snem ya ka jing shakri ka jongka. Baden ais ngubha sya baro kinong thi thuk thuk. Ringkat ka kabukser. Ban long kinong job ya santali ki laptop. Kani ka offer kan kot ha ka live hoteri unai lur R1000 R pusau.
Pelat Hapoh Ngut ki Briew ki layap naga Jingpang lamwir ke biabet naga jing Dait haki Ksew bat ki miau Hapoh ke jela Meghalaya. Haki Snem lalek no wat la ke sarkar jela klarai ben wat iki lak linti ben penyo ya ke doa inject anti-rabies vaccination wat haki primary health center ki beren haki shnong repair jang district ke jela. Haki jing kran bekilat bathai ku bor ke menteri jang sarkar jela ke bakmi ya ke tenak ko ke kia ke Dr. Mezel ambrinding do kalaya tho baka sarkar kla shim kia bha bat haki jing rakhi ke bishitio kinthi ya ke World Rabies Week kla danru ke jing terwa beriben pinkut no mardor ya ke ni ke Jingpang. Shwakane ke State Surveillance Officer of Integrated Disease Surveillance Program ke Dr. Valerie Lalu Kabulong ke Nodal Officer for Rabies kaya thu bekirat Hapoh Ngut ki Briew ki belayap naga Jingpang baki ya bit naga Dait haki Ksew bat ki miau hak bakat waitli ki degi jingja house nam arajar polai bakat ndrutli ki degi belajar hadu ubnai nai lur arajar posau.
Anti-Rabies Week, we want to firstly set the ball rolling on the sterilization and vaccination of stray dogs, which is undertaken by the Department of Veterinary. So tomorrow there is this culmination of this week-long awareness program where both the Minister of Veterinary and the Minister of Health will be together at the same platform to receive information on plans that are being proposed to curb this rampant spread of rabies. Like the doctor has just said, it is fatal, it is a serious concern. 27 deaths up to September 2024 is a number which is very alarming. We will meet tomorrow and we will take this forward and we will give you more information in the program tomorrow. Exactly. I wish that it was as simple as you say it is. Unfortunately, awareness on rabies we now realize has become a big priority. And hence, before the situation deteriorates, we are already planning an approach. And this approach is what we hope will happen henceforth. So it is very tricky because, as correctly pointed out by one of your own scribes, there are also protectors of stray dogs. Until all concerned stakeholders come on the same platform, it is going to be next to impossible to handle this. We hope that after this Rabies Awareness Week, we will be able to strategically attend to this big problem. And it is also not true that we are waiting for deaths to increase. A rabies vaccination is a responsibility of a citizen. There is also a talk that rabies vaccination are not available, etc., etc., etc. Hence, now we are committing to the state that we will ensure that up to the PHC level, there should be rabies vaccination available so that citizens can avail this facility to prevent that. We are hoping that this will happen soon and we are curbing it and we hope that we will be able to address it.
West Dait Hills and West Ksew Hills both have 6 deaths.
Highest number of deaths.
Extensive
awareness is required in rural areas. This is not a problem only of Meghalaya or Shillong. In fact, it is a national level program. I just would like to tell all of you, this is a national rabies control program. It's a national level issue. It's not only for us. In fact, it is even much severe in other parts. Here, we are taking much more proactive steps to see to the vaccines are available at that level. And these are all state procured vaccines also. And we are ensuring that availability is widespread. As like Madam said, that we have given that commitment and we are trying to maintain that commitment.
We are into surveillance of various diseases and rabies is one of them. So regarding rabies, first of all, I would like to say that we've had a lot of cases of dog bites, and 96% of rabies is because of dog bites. And out of these, we've had till the last case that was reported, that was the 16th death that happened this year. So this incident is also very unfortunate, because being a health professional herself, our MLHP, who's a nurse, she succumbed to this disease, which is actually 100% preventable and at the same time 100% fatal. So with vaccination and wound management at the right time, this disease could be prevented. But unfortunately, because of reasons unknown to us, the MLHP could not get the Congress-Tiful. She could not get the vaccine at the right time. And as I mentioned, rabies is a fatal disease. So once the signs and symptoms were, they started to be shown in her, there was no chance of, of getting back to normal. It was a progression towards fatality.
Number one, the person was bit by a small puppy. So people generally take puppy bites as something very casual. We should not take it like that. And vaccines for rabies are available at all the PHC level across the state. So please, anyone through the media, the request is that awareness that don't take any bites very seriously, and for those dog owners, please do that their pets are also taken care of. That is also very important. And this is the week which we are commemorating the Rabies Control Week program. Tomorrow, Madam and our Honorable Veterinary Minister also will be there. Along with that, we are doing a program. For the entire week, it's going on across all the state. Tomorrow is the last day of the program. So do not take any bites very, very casual. Immediate attention has to be given. Immediate approach after the health facility. And the rabies vaccines are also there, and medical officers are also being trained on this matter. So their consultation should be taken.
Probably lack of awareness, and at the same time complacency. As Sir had also mentioned, it was a bite due to a puppy. So usually we think that puppies are still sterile. They don't have any much diseases in them. We find them cute and harmless. But actually, puppies, less than 2 months, they are not vaccinated. So these are at the stage where if there is any infection in them, they are most, probably that they will infect another person who's bitten. We have, what happened is that rabies has been, it's a notifiable disease since last year. Okay, but 2023 March. So before that, there was not much of a system of reporting and of documenting cases. But from 2023 onwards, deaths were around, I think, 9 deaths that 9 to 11 deaths that happened in last year, 2023. So that was high. I think it was 11, not to be mistaken, and that was for the whole calendar year. This time it's only in the month of till September. We haven't, it's not complete yet. So we still have actually 17, but the 17th case we have not completed our investigation yet. So officially it is 16 cases of death cases. Most of the cases were stray dogs. Only 1 or 2 were their own pet dogs, but majority were stray dogs. And also because of, most majority of them were in rural areas, and also the majority of them did not receive any vaccination. So the post-exposure prophylaxis was not given to those, they had not taken after the bite. So we are currently having a very good coordination, not only with municipal corporation, but also with veterinary department. Yes. We are, if you can come, you are all invited tomorrow. For the 11 o'clock. Tomorrow 11 o'clock we're having this function. It is in collaboration with the veterinary department and also municipal corporation. We're having a program tomorrow. What we've been municipal, in fact they have dog catchers, and one dog catcher who has been doing all this, they've been catching stray dogs, and the veterinary department has been conducting these mass vaccination campaigns all across the state. So even now, it is happening across the state. Yesterday, it happened in Southwest Ksew Hills and East Ksew Hills.
So far, how many dogs have been vaccinated?
So the report we have for this year itself, from East Ksew Hills alone, 600 stray dogs have been vaccinated so far.
We have a joint steering committee made up with the Chief Secretary
Yes.
with all these stakeholders. We have already had a meeting this 1 month back. In ESA Mall, we had a meeting. As a culmination of that, only this week is also been commemorated. Now the sharing of information, etc. also has started.